continue speaking before another, and to discover speaking skills that you already have and skills that you need some improvement. The time is 4 to 6 minutes. So you will be getting the green light at 4 minutes, the amber light at 5 minutes, and the red light at 6 minutes. You have a 30-second deviation on either side.
Thank you. Back surgery. Steel rods and 40-degree spine is not stopping Paul's success. The title of his speech, Scoliosis. What's that? Scoliosis. What's that? Toastmaster Paul Finkelstein.
I like watching Toastmasters sharing exercise with the lectern. Fellow Toastmasters, welcome guests. When I graduated high school a while ago, yesterday, everybody went to party that day after the exam week. And Paul went to the hospital. He found out that he had scoliosis, but not just a minor 5-degree curve. His orthopedic doctor socked it to him, really socked it to him. And I will digress with this sock in a few moments. To be so disappointed, I was sitting in the doctor's office like this, and my mom is here, and my dad is here, and they put the x-ray up on the wall, and you could see right through yourself, of course, with the x-ray. And he took his protractor out, and he drew with his protractor, and he drew the lines, and he said, okay, that's what my back looked like. On the inside, it was 40 degrees. Well, months before, actually, they thought they could correct it, and it went to 12 degrees. And it went to 15. I went to camp, and I wore a back brace, really thick. It was like football gear. And they put Velcro behind me actually, I had to put it on and take it off every night. Didn't work. That doctor socked it to me. Now, for 2 months after the surgery, which did take 2 weeks in the hospital, and pin cushions for morphine shots, I guess that was the first time I did drugs when I was in the hospital. And the only time I did drugs, serious drugs. And the only time you knew it worked is when I sweated like crazy. I'm like, it's working, I'm sweating. I don't feel any pain. And then it wore off. Please, nurse, ring that bell. Thank you. Gotta work that cue. So now, for 2 months, since I was in the hospital for 2 months, for 2 weeks, for 2 months, I had to wear a body cast like this tube sock. And I had to put this over my entire body. Now, I didn't care whatever the doctor said I had to do for therapy, but the fact is it was necessary to take this body tube sock from underneath the cast, the body cast. It was from here to here, all the way around in one little hole for my stomach. And I had to take that off, and the only reason why was because showering and hygiene was important in our house. You could absorb that for a second. Imagine if I didn't do that for 2 months, I would really, if this was underneath and it had sweat for 2 months straight, not good in your house either if your child, or you had to go through with that, you'd probably be stinking yourself. Okay, so there was a hole at the top and this. Now, inside me, I had this, a steel rod, from here to here, all the way up. I don't beep at airports. I am so annoyed by that. I know that this is the bionic woman, and she probably wishes she was me. I have this inside my back, and and I don't beep at airports. That's so unfair. After all that trouble, the doctor said that the muscle that grows around your spine is like a force field for this. I said, okay, doc, that's good. So at least I don't have to worry about TSA and Homeland Security. Now, this is inside against my spine. The doctors took out this bottom rib here, took out this bottom rib here. So I have two bottomless ribs. I guess I'm like Adam and Eve. Doesn't he give away his ribs or something like that? So those two bottom ribs, and they chopped them up, and that's what they used to fuse this to my spine, those two bottom ribs. So I guess I'm chop suey. With all that said and done, I've managed to do at least 10 different half marathons and marathons. And probably the number one question I get is, could you bend over? Like, can you bend? They thought that when you bend, that you have to, I'm trying to purposely curve my back to bend, but nobody bends from your back. You always bend from your waist. So that's the number one question. But of all of the excuses you could possibly have here at Toastmasters, whether it's steel rods, and whatever Sarah said in my bio, what was it? Back surgery and spine surgery and steel rods. With all those excuses, all you have to do for your icebreaker speech is pick up a manual. It's 4 minutes. And it doesn't matter what you say. Those 4 minutes, whether it's an advanced manual or a competent communicator manual, those 4 minutes will change your life and those that are in the room with you. So go ahead and give as many speeches as possible, because those 4 minutes make all the difference in the world. Toastmasters.